so with that, I will honestly, I mean, I've worked so closely with Mary. I don't even know where to start in terms of an introduction with her, but we've been working together and have a shared passion of working on pregnancy and arthritis. She's the supervisor working with Dr. Vienna Cheng, who I'm so happy is also interested in this a very important topic. And so I will just pass it on to the two of them. So thanks so much.
Thank you, Lori. Thank you, Lori. And I think you hit it spot on when you said shared passion. It really is a shared passion that I have with Lori, and I think that's how we first met, and I think we've sustained such a great partnership. But I think we're more just like partners. I consider Lori one of like my, a great friend, and I think the same thing with Netta. It's that shared passion, and I cannot envision doing this work without Lori and Netta. I think, yeah, and I'm just really grateful. And I think events like this is that opportunity to meet others with that shared passion, because I think it really is a community that we need to keep moving this work forward. So I have a bit of what I think is like some reassurance, just showing a bit of a highlight of what's been happening in arthritis and pregnancy research. So I started my career as an assistant professor in epidemiology and health services research in 2013. I'm just going to wait for that delay to move the slide. And I have to say, when I started, I had a lot of work to do because it was, we had just entered the biologics era. And I think prior to that, there really was a lot of hesitancy, anxiety, and question mark of whether women with arthritis can be pregnant. So I had what I called my first grad was this Family 1.0. And one of the big questions at the time was, how do arthritis medications impact the health of the mom and the baby? And I'm just showing you a bit of timelining here, because again, we had just gotten the first biologic approved in Canada in 2000, and they had shown such great promise, but question mark, what will they do when the mom takes them during pregnancy? And then also up until that point, we still didn't have much understanding about what happens when DMARDs are taken. And I also wanted to highlight here that I want to underline that its impact on the mom and the baby, because a lot of perinatal research to this point has actually focused on the baby, and rightfully so. So I'm a mother of two children myself, and I think the first thing we think about when we get pregnant is, what's going to happen to the baby. Malformations, are they going to be delivered? Like, how big are they going to be delivered? So a lot of the research has been following that, and it actually has ignored the mom. So we don't know about maternal flares, maternal mental health, maternal complications like preeclampsia, gestational diabetes, and so on. So so that was the first part of the research. And at this time, I was using administrative data. So that is healthcare encounters of women in BC, because when you are looking at arthritis and pregnancy, it is still quite a rare event, especially at that time when, again, very few are considering pregnancy because of so much uncertainty. But that research actually led to some good news. So using that data, we were able to show some reassuring data that biologics taken during pregnancy did not lead to adverse outcomes. So we showed that there was no associations with congenital malformations, there was no associations with preterm deliveries, there was no associations with small for gestational age, and there was no associations with infections in the mom and also on the baby. And it's not moving. Maybe I'll just wait. That delay. Oh, and this is just like a little bit of an infographic that just we were using to share that study. So it was a bit of a good news. So as we were generating the study, again, so lucky to work with Lori, that we really need to take ourselves out of like the data and still look at the experience. And thank you to Christina, because on your talk, and I really appreciate your timelines, it's almost like we planned it, but we didn't. You showed a timeline, and then there were some words that you said that really resonated with me, and one of them was like the difficult decision. So here I was, the researcher, the scientist, thinking, okay, here's some great data now. Women with arthritis should be able to start getting pregnant, but then, but it's not just as easy as, okay, now you can take the drug, right? There's so much to unpack when you think about, okay, what really goes behind that decision. So in 2019, we launched what was called the Mother Study, where it's, okay, let's take a step back from the numerical data, and let's hear the narratives and the stories. And actually, this was a study that I first met Christina at when she was a participant in that study. And I have to say, learned so much talking to mothers, women who are making that decision about how complex and how difficult it is. So it's really not moving, is it? Maybe you could just move it for me. So this was the study. So, and then actually the other thing that came out of that study, again, inspired by Christina and our other participants, is that it's not just the women. This is something that also impacts their partners. So we actually had a spin-off study where we interviewed the partners of the women who were living with arthritis and making these difficult decisions about whether they were going to get pregnant, whether they're going to take medications during or before their pregnancy. Now we can go to the next slide. And this is just a snapshot. Like I have a QR code for the paper, but this just shows when we try to conceptualize what is involved in that decision. It is the intersectionality of individual identity, their desires, beliefs, values, and needs, their patient identity, their experience of the disease, their familial identity, again, the relationship, the expectations of growing a family, and then the societal demands, right? Like, what is it like to be a woman living with a chronic disease? What is motherhood like? So I really appreciate the conversations we started with Nazret and Shani, because I think it really does, put into that lived experience what we've been able to show with this work. So I'm looking forward to follow-up conversation of how we could work together. And then just the last slide, we're getting into Family 2.0. So if you go one more slide over, so the promising thing in arthritis is the medications, the treatments have continued to evolve, and we've now entered the biosimilar era, the targeted era, and then we've now have longer time where we have biologics being used and also conventional DMARDs being used. But we've now, more than ever, we need to answer those questions about the impact of the mom and the baby. And we've called it Family 2.0. And it really is that holistic look, because not only do we want to look at the baby, we also want to follow these babies until they keep growing. So, we want to see happy little Isaacs go from childhood into adolescence and into adulthood. And with that, I'm going to turn it over to Vienna just to highlight some of the work that we've already started on Family 2.0. So thank you.
Hear me? Okay, all good? Okay, so I'm just gonna dive right in. I'm gonna try to flip my slide. If not, if you don't mind, oh, there we go. Just a bit of a lag there. But just moving on to the next slide. So I'm just going to dive right in. So we are particularly interested in a group called Targeted Synthetic Disease Modifying Anti-Rheumatic Drugs, or TSDMARDs. This is a unique group given by mouth that we are interested in for my master's project. Specifically, we want to know their effect on pregnancy outcomes. But before setting out to discover the answer to this question, how do we know where to start and which research areas we should focus our efforts on? So we start by conducting a scoping review. Anybody here love road tripping? Similar to setting out on a road trip across the country, before hitting the road, you would usually pull up the GPS or do some research to scope out the best attractions along the way, right? So a scoping review is a bit like doing that research beforehand. We want to know what hasn't been done or what has been done, and in other words, where the gaps in literature are, to know which path we should be going down with our research. So the purpose of a scoping review, just waiting for the next slide. The purpose of a scoping review is to comprehensively search for all of the existing evidence you could find on a research question. So the question that we set out to answer is, what is the evidence on the perinatal use of targeted synthetic DMARDs on pregnancy outcomes in those living with rheumatic diseases? So we searched 3 large literature databases to find 7,349 studies that could be related to our topic. And after sorting through all of these studies in detail, we ended up with only 6 studies that answered our research question the best. So there are 3 targeted synthetic DMARDs currently approved in Canada. From our search, we found 5 studies that reported on the drug tofacitinib, 1 study on the drug baricitinib, and no studies on the drug upadacitinib. Out of the 6 studies, 2 of them were case reports and the other 4 were non-case studies. So I'm going to report on our case study results first. The first case was a mother in Italy using baricitinib to treat her rheumatoid arthritis. So she took this drug until 17 weeks gestation before discontinuing and delivered at 38 weeks gestation. And the second case is a mother in Spain who is taking tofacitinib for her psoriatic arthritis. And she took this until 6 weeks of gestation before discontinuing and subsequently delivered her baby at 36 weeks gestation. So after analyzing their outcomes, we found that only one of the mothers of the 2 case reports delivered at term. Both the mothers delivered their baby via cesarean section, and fortunately, both mothers remained in clinical remission and had their disease activity monitored throughout pregnancy. As for neonatal outcomes, or the baby outcomes, both the studies reported on live birth, and both mothers delivered a live, healthy baby with no congenital malformations. And the baby in the first study reported to have no infections, and the second study didn't talk about it, so we don't know. And moving on to our non-case studies, these are papers that studied the outcomes of small sample sizes just at a glance. So there were 4 non-case studies in total, all of which included patients that were exposed to the drug tofacitinib only. So starting at the top there, the preterm birth was reported in 2 out of the 4 studies, followed by miscarriage, medical termination, and all 4 studies reported on live birth. In terms of the baby outcomes, only 1 of the small sample studies reported on whether their babies had serious infection, and half the studies reported on low birth weight, and 3 studies reported on perinatal death and fetal malformations. So as we can see here, none of the non-case studies reported on any outcomes in the mothers or fathers, so that's an area that could require more research. So since the literature we found were all case reports or studies with very small sample sizes, causation between the drug and pregnancy outcomes is not clear, so we don't know whether the drug actually causes these outcomes. But now that we know what has and hasn't been researched from our scoping review, this will better inform the research that we do for my master's project and also future studies with Dr. De Vera's team. So our research will be using Canadian population-based data to help make more confident conclusions on these associations. So ultimately, our results will fill in the gaps in the literature that is urgently needed and provide ease for future mothers and fathers during family planning conversations with their doctors. So we are very excited for what to come. That is my last slide.
All right. Thank you so much, Vienna.